Good morning, everyone. I'm Hakim Yadi. I'm the Chief Executive of the Northern Health Science Alliance. But before I start my presentation, I just want to do a quick straw poll. How many people have watched the American sitcom Friends? Good, pretty much everyone. So there's a scene when Joey turns to the group and says, "I'm going to move to China and eat lots of Chinese food." And Chandler cuts in and says, "I think there they just call it food." Now, we might call it connected health, digital health, the future of healthcare. Patients just call it health. And I think that's something we all have to remember as we embark on this critically important project that is Health North and that is Connected Health Cities. So the Northern Health Science Alliance, an organisation that I run, covers the whole of the north of England. It was founded by a number of hospital chief executives and academic leads, and it forms part of a connected ecosystem with other organisations in Scotland, like Health Sciences Scotland, us in the north, Med City in the southeast, new hubs developing in Northern Ireland and in Wales. And if you want to understand more about what each of these individual clusters is doing across the UK, the Wellcome Trust and the Academy of Medical Sciences published a report last year on what each of the clusters are doing. So us in the north, the Northern Health Science Alliance, as I said, brings together 8 leading teaching hospitals, 8 academic institutions, and critically the 4 academic health science networks across the north of England. It's a company which is quite unique, and it works across the region to benefit both health and wealth. So what do we do? Well, we have 5 main functions: promoting the value of the north of England, and ironically, as the Northern Health Science Alliance Chief Executive, I'm based in London, and that's to shout about what's going on here, down there. Acting as a front door, working with organisations like UK Trade and Investment to make sure that the north is put on the map. In 2 weeks' time, the NHSA is launching UK government strategy for the Northern Powerhouse in life sciences in San Francisco at the largest biotech conference in the world. So we're trying to put the north on the map. Working across our members to link the research infrastructure, whether it be in oncology, whether it be in neurodegeneration or in connected health. Working with industry partners and working with the research funders. And we've got a number of key areas of expertise in the north of England. So over the past 3 years since we formed, we've looked at where our research strengths are, not as Liverpool, Lancaster, Manchester or Leeds or Newcastle, Durham or York, but what do we have across the north? And it really fills these areas around precision medicine, healthy aging, population health, fantastic research in terms of clinical trials, and particularly in e-health and health data analytics. One fact that we're putting out through the launch of the Northern Powerhouse proposition in 2 weeks' time, and something that isn't very well known when it comes to clinical research. The north of England conducts more clinical trials than London, Cambridge and Oxford combined. The United Kingdom conducts 30% of Europe's clinical trials. The north conducts 30% of England's clinical trials. These are the sort of facts that we should be promoting aggressively to parties outside of the north of England. So when we'd gone through this analysis of where our research strengths are in the north, the health data and health data analytics came out strong. And here we've got some of the leading centres, whether it's SciTech, the FAR Institute, the new EPSRC Cloud Computing Centre in Newcastle, or the Smart Data Centre in Newcastle. We've got some great expertise in the northwest, in Manchester, in the northeast, and in Yorkshire and Humber. Unfortunately, combined with this great expertise in health data, we have a real challenge around health equality across the country. Life expectancy between Bradford and Guildford can differ as much as 19 years. And this isn't driven by the quality of clinical care, it's not driven by a lack of innovation in the north, it's the socio-economic determinants of health. And it's being driven by diseases like lung cancer, liver cancer, heart disease, and COPD. So how can we use our research infrastructure, our excellence in understanding how to redesign care pathways, how to use big data for the benefit of patients, to actually start to address this social inequality between north and south? So back in October 2014, the NHSA put a white paper into government around our areas of expertise, trying to encourage them to put some of their new national centres in the north of England. As you know, national centres drive local growth, and we need more of those in the north. And we focused on health data, precision medicine, and population health. Interestingly, government responded. And in the January of 2015, we had a round table of the NHSA, the Prime Minister, the Chancellor, and George Freeman, the Minister for Life Sciences, where we put forward our very ambitious plans for a project called Health North. And Health North had three components: Health Data Analytics Centre, a Precision Medicine Academy to train the clinicians of the future in personalised and precision health, and Connected Health Cities. In March 2015, 15th of March, I remember it well, it was the budget, and we were allocated £20 million for Connected Health Cities. Since then, took a while to convert, but in November last year, we actually got the grant award letter from Jeremy Hunt saying we'd actually got the funding for Connected Health Cities. And a huge thanks to many people in this room that made that transition from one sentence in the budget to the grant award letter. Then, in January this year, we had the official start recognised by government of Connected Health Cities, although over the past 8 or 9 months, and even longer going back to March last year, a huge amount of work has gone in before actually starting the project. And over the last few months, it's really been project setup mode for Connected Health Cities. So let me just give you a bit of information about what the vision is for Connected Health Cities. For each of us interacting with different public sector services as we engage with the city region, we're creating a digital exhaust. Digital information in silos across local authorities, with other public sector services, with our health service, with our social care service. We're also generating our own data that Declan referred back to. And what can we do with that data if we were to bring it together to better understand how to manage a patient, a citizen with a disease in a city? So how can we use pharmacy data, spending data, health and social care information to design new models of care for our northern cities? The idea behind this is focused on providing an environment for people, processes and information to come together in a joined up way in what we're terming arcs, where we can share learnings between the different parties that work together, normally quite isolated within a city region for the benefit of health. By bringing it together and engaging with some of that research infrastructure like the FAR Institute and others, we create an environment where we can actually start to understand the value of what we already have access to, albeit individually at the moment. Where we are at the moment is all of that information, the people more than anything else, are working for different organisations in different silos for different reasons. What the ARC construct gives us is an environment to bring those people together, whether they be from academe, from the NHS, from the civil service, or from industry, into an environment where we can work collaboratively together. For those of you who really want to dig into the architecture of this, there's the paper by John Ainsworth and Ian Buchan, Combining Health Data Uses to Ignite Health System Learning, Ainsworth and Buchan. It's a very good read, and it's the schematics for Connected Health Cities. So where have we got to now? Well, we've got 4 Connected Health City regions across the north of England: North West, Greater Manchester, North East, and Connected Yorkshire. Over the past 6 or 7 months, the different teams have been working up the therapy areas and care pathways that they're going to be tackling. In the North West, as we'll hear later today, alcohol misuse and unplanned care. In Greater Manchester, building rapid interventions to reduce microbial resistance and stroke care. And the North East and Connected Yorkshire will be defining their care pathways at the end of this month. So I'm delighted to be here today. I'll be around all day to take any questions about what we're doing at the level of Health North, how we go on and build on the £20 million investment to get more investment into the Health Data Analytics Centre and the Precision Medicine Academy, which we're still hoping to deliver as part of the wider Health North project. So thank you.
Right.